Dr. Hampton here again with some important insights that literally may change your life. I'm here with Nina Teicholz, who is the executive director of the Nutrition Coalition, which is devoted to making sure our nutrition policy is evidence-based. She's also the author of The Big Fat Surprise, where her investigative journalism challenged conventional wisdom that dietary fat caused heart disease. We now know that simply isn't true. Today, I've asked Nina to share why we both believe that you, your doctor, your nurse practitioner, your pharmacist, your dietitian, and anyone else trusted to help you protect your nest should not trust the dietary guidelines. Nina, do me a favor and share what you have found in your research to be true about the dietary guidelines.
Yeah, Tony, thanks for having me. Well, the dietary guidelines are a massively influential policy that really affects what your doctor, your nurse, your nutritionist, your all of your healthcare practitioners, your hospitals, everybody will tell you as a healthy diet. And what research really has, a lot of my research and other research has shown, these dietary guidelines are not based on strong evidence. A little snapshot of that is that a donut is a perfectly acceptable food on the guidelines and is in fact fed to our children at schools because the guidelines advise 6 servings of grains per day, including 3 servings of refined grains and up to 10% of calories of sugar. So your children can get grandma's chocolate chip cookies, that's on the lunch program, or donuts or Doritos as part of the dietary guidelines. I think that one of the major problems with the guidelines, one is if you follow them perfectly, you will still not have a diet that meets all your nutrient needs as defined by the National Academies of Sciences. So you will be lacking iron, vitamin D, vitamin E, choline, and folate. And if you did not eat those refined grains, which are enriched and fortified, you would also be short of B vitamins. All of these are crucial to maintaining your health, maintaining a strong immune system, which we all have come to realize is so important, and for healthy reproduction. You cannot have healthy babies if you do not have all of these nutrients. So it's really problematic that the guidelines don't meet these nutrients. The main reason that they don't is that they have maintained a non-evidence-based cap on saturated fats that limits the nutrient-dense foods where you can get those nutrients, like eggs, like cheese, meats. I mean, all of those foods have those nutrients and they have them in the most bioavailable form, but the dietary guidelines cannot advise enough of these due to the continuing caps on saturated fats, which for at least a decade now, really the science is clear that those are not supported by rigorous science. Let me just talk about one of the things that I think is really crucial about the guidelines that I myself only found out about recently, which is that they are only for prevention of disease. They are not for treatment of disease. And in the beginning, when the guidelines were launched, most of America was healthy. This was in 1980. Now we live in a population where 12% of the public is metabolically healthy. 60% have been diagnosed with a metabolic disease of some kind, obesity, diabetes, heart disease. So we're talking, most of the country has one of these diseases, and the dietary guidelines are just not for those people. They don't review the science on treatment of those diseases. They don't incorporate it. In this last go around they're issued every 5 years, they excluded all the science on weight loss. So they're really not designed for weight loss, which we know is very important for able to fight other diseases. So the guidelines really are a mismatch for America, for the diverse and metabolically unhealthy population that we are. What is so disturbing is that the guidelines most people just don't know this about the guidelines because they don't really tell the American public, and they disseminate the guidelines saying they're for everyone. They say they're for all Americans, which just is simply not true. And if you're in a school or a nursing home or in a hospital or in many institutions, you are given the guidelines, women and infant children programs. Even though you may have diabetes or have obesity, you're receiving food or information, education that is really not appropriate for your condition. So this is one of the things that's deeply worrying to me about dietary guidelines, that they're applied to all Americans, but they're designed only for that healthy 12%.
Wow. Nina, just listening to you, and I know we did a podcast together, it breaks my heart that we actually use these guidelines as clinicians to target the sick people, right, in our practice more than anything. And to know that they're not really serving them, it breaks my heart. And that's really the reason why I wanted to get you on this video and talk about it a little bit, because so many people are just not aware, not just patients, but my clinical colleagues. So I really appreciate you giving a little insight. Maybe one more point. You know, a lot of times your Nutrition Coalition talks about evidence-based. Maybe just a couple of thoughts about, what real evidence should look like. And I think that people need to hear that as well.
Yeah. So to have evidence-based guidelines generally means, according to the international standards that are out there, that including the National Academies of Sciences, it means that you need to have several clinical trials, at least one or two at least clinical trials, the kind of science that can show and demonstrate cause and effect in order to make a population-wide recommendation, and that these recommendations or guidelines cannot be based only on data that shows only associations, right? So this is a very weak kind of data. It's called epidemiology, prospective cohort studies, case control studies, observational data. Those are all sort of words for that kind of data that shows association only. If you prescribe a pill to your patients or you receive a pill from your doctor, that pill has gone through a clinical trial in order to be approved. And most of the guidelines, our nutrition guidelines, are not based on that level of evidence. They are based on this weak science. And the clinical trial evidence that we have actually contradicts our dietary guidelines. I mean, this is an amazing fact that, like, for instance, the low-fat diet, which has been tested and found to be completely ineffective for fighting any kind of diet-related disease, that huge clinical trial on 49,000 people was really ignored. And then other data was, weaker data was used to substantiate the low-fat diet for many, many years. So it's a problem. I mean, the process that is used to create the guidelines is sort of made up by the government agencies that do this, the USDA and HHS, but they really don't follow international standards. And I'll add just one thing, which is that Congress allocated $1 million to the National Academies of Sciences for that, the National Academies to do what was really the first ever outside peer review of the dietary guidelines. And one of the things they emphasized was you need to use a state-of-the-art system for making guidelines and reviewing the science. And the USDA basically said, we're not going to do that. So it's a problem. We have guidelines that are not trustworthy. That trustworthy is the word that was used by the National Academies of Sciences, that they need to be redesigned in order to be trustworthy. We need trustworthy guidelines.
I love that. And what I'll do to make sure that what we share is trustworthy, I'll share some studies that compare a low-fat diet to a low-carb diet. And guess what, guys? There'll be 100% randomized controlled trials which do show causation, and that'll prove Nina's point. So I really appreciate you. This is very important information, and I just wanted to make sure we got in front of you guys and shared this. And, like Gary Taubes, who wrote Good Calories, Bad Calories, it took the work of 2 investigator journalists to provide the clarity we needed to remove the fear of saturated fat in our diets and to reveal that the dietary guidelines are not a reliable source of nutritional advice. I really encourage each and every one of you to do some investigative journalism yourselves and check out the work of both Gary and Nina. You also may want to listen to the Protecting Your Nest podcast episode I did with Nina. That episode was number 29. And if you're a clinician, it's extremely important that you add this knowledge to your clinical practice so that you will no longer have to rely on dietary guidelines that simply don't serve the needs of the patients you care for. I really can't wait to hear your comments about what you've learned here today. And please make sure to like and subscribe this video. And until next time, be safe, be well, and continue to protect your nest. And thank you so much, Nina.
Thank you.